It's Mrs. Lance and Nina, your favorite instructors. We are now going to demonstrate the IV fluids, IV piggyback, and IV push. When you're doing your checkoffs, we are not going to dictate to you what order you do these in, but these are the steps that need to happen.
Ready, whenever you are.
Verify healthcare's orders for accuracy and completeness.
Okay.
Assess patency of pre-existing vascular access device. So in this instance, a saline flush, a saline lock.
Allow it to dry.
Current policy states recommendations from the CDC is you scrub the hub for 30 seconds.
Good blood return. And flushes easily.
You perform hand hygiene and gather all the necessary equipment and supplies. Provide for patient privacy. Identify the patient using 2 identifiers, and which would mean you would verify the armband, which is on this guy's other arm, with the MAR, and then you would also be verifying the medication through the same scanning system. Make sure that you have correctly calculated and identified the rates that you're going to give these IV fluids. Prepare the extension tubing, IV, and solution for, okay, hang on. You're going to IVs, even if it's fluid, are considered medication, so you follow all 6 rights. Check the solution for color, clarity, expiration date, leaks.
This is expired. This is expired.
It is expired.
It's expired.
So, in the real world, if it's expired, we would not give it. In SIM, nothing ever expires. Open the infusion set, place roller clamp about 2 to 5 centimeters below the drip chamber. Roll the clamp off position.
Undo the spaghetti.
And a good strong tug straightens out all your kinks. Remove the protective cap from the tubing insertion spike and insert the spike into the IV ports bag. Maintain as aseptic technique. Compress the drip chamber. Prime the infusion tubing by filling it with IV solution. By slowly unclamping the roller clamp. Tapping Y ports to displace any air. By not taking off the end, the end of the tubing cap, you're maintaining sterility. Insert your tubing into the IV pump. Make sure all clamps are undone.
Next.
Clean the patient's hub and connect IV tubing. Every facility has their own policies regarding labeling IV tubing and IV bags. Here at Blinn Memorial, we tag the tubing, and that has changed every 24 to 72 hours depending on policies and medications. And as every experienced nurse will tell you, you always wait a second once you get the pump programmed to make sure it is dripping and there will be no alarms. For IV push medication, you're going to you're going to verify your patient's healthcare provider's orders. We've already identified our patient. We've already assessed our IV sites. You're going to need to calculate the correct amount of fluid to draw up based on the dosage ordered and the available medication. If it's a glass ampule that you're using, remember you'll need to grab a filter needle. You're going to need to check a drug reference manual to determine how quickly the medication can be given and to ensure compatibility with the primary IV solution.
I like Skyscape.
The medication has already been checked to verify it's in date. We still maintain the 6 rights of medication administration. Again, you're going to compare your labels of the medication with your MAR to double check everything matches. You're going to discuss the purpose of the medication and teach the patient about any side effects. This patient has had morphine before, knows the side effects. Clean the injection port closest to the patient. Insert the needleless tip of the medication syringe to the port closest to the patient that you've already scrubbed. Occlude the IV line from above the injection port. You can simply pause the pump. Inject the medication, remembering the time of how slow it needs to be given. You can pinch the IV tubing while you're injecting that. Withdraw the syringe and recheck that the IV fluid infusion rate and make sure that the pump is back on. During your simulation, you will be required to give it over the amount of the medication. If it's 2 to 3 minutes, you will be required to give the medication over the 2 to 3 minutes. You will also be quizzed on whether, if you decide to give the IV push medication prior to starting fluids, that remember you use saline medication and then flush again with saline. The flush at the end is done at the same rate of administration as the medication that you've given. And last but not least, our IV piggyback. Again, the orders have been verified, the medication has been checked for expiration. We've assessed the patient and asked the patient for any known drug or latex allergies. If there is any relevant lab information prior to the administration of a medication, remember that is verified beforehand. You have correctly calculated the infusion rate.
This particular antibiotic is infused every 30 minutes.
You've ensured that the antibiotic is compatible with the primary IV fluid running. Remember to educate your patient regarding the medications.
Yeah, how do you want me to prime it? Do you want me to show them how to backflow, or?
Let's show them how to back prime. Because you can prime it just like you would primary tubing, but you can also back prime. And the reason I need you to know how to back prime is frequently in the hospital, when you go to hang your medication, there's IV tubing there that's dedicated to this medication, but the nurse before you let that IV tubing run dry. Because it's a secondary tubing and then the primary tubing has taken over. So learning how to back prime is going to help you and save you time in the long run. So it is back prime by holding the piggyback lower than the primary tubing. Whatever is hung highest is what's going to flow. So for your piggyback, if that's the medication you want to give, it has to be hung above the IV fluid. Depending on the pump you have, you can program a secondary line, and it will automatically convert back to the primary infusion rate. With the primary tubing, once the prescribed volume to be infused has been administered. With all of your checkoffs at the remember at the end, anytime you leave a patient's room, you are to leave them safe, which means bed down, 2 side rails up, call light within reach. You can always clean up after yourself, dispose of all your things, and this ends our IV medication demonstration.